How has the pandemic affected your area of healthcare? And what is the new normal for mitochondrial disease research and clinical visits for your specialty?
The pandemic has had a great impact on healthcare in general. When we first realized how bad things were in the United States, the majority of the healthcare system as well as the research system shut down. And that created a void in two areas that are very distinct but both very important. From a research perspective, a lot of our ongoing clinical trials had to stop because patients couldn't get to the clinical sites to perform their study visits. We still don't know what impact that's going to have in the long run on the clinical trials that we've been running, and as far as being able to assess the efficacy of treatments that we've been testing. I'm happy to say that we have found a way to mitigate the risks for our patients, and we have reopened clinical research in a way that we feel is safe and still able to assess the medications and the therapies that are being developed. So we are moving forward in that arena and hoping that we can get back to where we were just a few months ago. From a clinical standpoint, we also shut down, for the most part, all of our elective clinical visits as well as elective clinical procedures for several months. Thankfully, our offices were able to get a telemedicine program up and running relatively quickly, which enabled us to stay in close contact with our patients so that we were able to still provide them with medical services and medical care. Unfortunately, there are a lot of people who are still afraid to come into medical systems to get labs drawn, to see their physicians, to have necessary procedures performed. And we're realizing more and more every day what a detrimental impact that's having on people's healths. So I'm hopeful that people will begin to reutilize the medical system in a way that is safe and careful so that they can continue to access these necessary elective medical needs.